Hello, I'm Dr. Ken Landau. Thanks for joining us. This is Well Now Doctor. We're going to be discussing hepatitis C. We've already decided that hepatitis C is a very common condition. It's estimated that here in the United States, somewhere around 2.5, maybe 3 million people infected with the virus. It's estimated that somewhere between 3,000 and 17,000 people will die because of the virus. That's in any given year. We've decided that in the world, there are probably somewhere around 60 million to as many as 170 million people with the virus, and as many as 350,000 people worldwide will die of the virus. We know that just because you're infected doesn't mean that you're going to have any symptoms, and in fact, we've decided that the overwhelming majority of people infected with hepatitis C don't even know it, and that's why the government has decided that we ought to screen people to find out if they're infected. Well, if you're infected and you don't have any symptoms of the virus, you've got to say, well, why are we looking for it? Well, we look for it for a variety of reasons. Maybe we're trying to prevent infection of other people. That certainly is a very good idea. And as far as you're concerned, well, we might prevent your developing the cirrhosis or the liver disease in that small percentage of individuals who would otherwise be likely to develop problems. But the problem with the hepatitis C virus, or at least the treatment is concerned, it's extraordinarily expensive. We already decided that it costs well in excess of $100,000 to treat one individual. And once you're treated, especially if you're an intravenous drug abuser and we find you, you're in the prison and we find you and we treat you, you don't get any benefit as far as the prevention of a second bout or a third bout of the hepatitis C is concerned. Well, let's talk about hepatitis in general for a few moments. We talk about hepatitis and we throw the words around, hepatitis A, hepatitis B, hepatitis C. But what do we know about these viruses? And are they similar in their symptoms or are they different? Well, we know that hepatitis C is what we call a flavivirus. Now, you've heard about the DNA. Well, this virus doesn't contain DNA. It contains RNA. And it's spread, obviously, through some blood contamination. Now, for the overwhelming majority of people, that means intravenous drug use, or you were born between 1945 and 1965 when we didn't know any better, and then when you were growing up, maybe you received a blood transfusion, or maybe you received a needle stick, and as a result, you could have been infected. So that's why those two groups seem to be at highest risk here in the United States. Well, what's the number of people who become infected each year? It's surprisingly low. Actually, the number of reported cases is only about 3,000 a year, but with the number of cases that are not reported, and actually the number of cases that develop, but we don't even know that they have the virus, it's thought that maybe as many as 17,000 to 20,000 people will be infected in the United States in any given year, and we think that overall, about 70% or 80% of those people are going to go on to develop chronic infection. They might not know it, and in the overwhelming majority of cases, they don't know it unless they go and see their doctor and have a routine screening test and they find an abnormal result on the blood test, or if they're screened specifically for the virus. Now, we know that from the time you're infected with the virus until any symptoms develop, if the symptoms are going to develop, and remember, they only develop in about 1 in 4 people infected with the virus, but in order for the infection to occur, it's going to take somewhere between about 6 and 7 weeks. We know that that occurs, as I said, about 20-25% of the people, probably about 15-20% of the people going to spontaneously clear the virus, and we know that the overwhelming majority of people infected with hepatitis C virus are going to go on and develop chronic inflammation of the liver. But fortunately, that chronic inflammation of the liver in the overwhelming majority of people is not going to go on and cause any kind of symptoms. Now, we do know, on the other hand, that if we look at people and we follow them for a long enough period of time, somewhere between 5 and 10%, maybe a few more, going to develop cirrhosis, but for the overwhelming majority of people, it's going to take 20 or 30 years, even longer, for them to develop the cirrhosis, and you can't get the major complications of the liver cell cancer, hepatocellular carcinoma, until you have cirrhosis. So what's the likelihood of dying from hepatitis C, going on and progressing from cirrhosis to Hepatocellular carcinoma? Well, it's probably only about 1 or 2 or 3 or 4%. What are the symptoms of hepatitis? And it doesn't seem to make any difference whether we're talking about hepatitis A or hepatitis B or hepatitis C. When they are symptomatic, and they are just like hepatitis C, frequently asymptomatic. Well, if they're going to cause symptoms, what are the symptoms of hepatitis? Hepatitis is inflammation of the liver. It is non-specific. Hepatitis causes symptoms of loss of appetite, or you have some nausea, or you have some vomiting, or you have some abdominal pain, or you have some joint pain. Maybe you have a low-grade fever. Maybe you're tired, you're fatigued. Sometimes your skin becomes itchy. Maybe if it progresses, you could suffer some weight loss because you don't have any appetite. You just don't feel well. Sometimes you just have that malaise symptom, or the symptoms of the common flu. At times, if the inflammation is severe enough, you could go on to develop the yellow discoloration of your eyes and skin. We call that jaundice or icterus. Your stools, your bowel movements may turn light. They can become clay-colored, and your urine can become very dark. Well, those are the symptoms of any kind of hepatitis. Now, before we get back to hepatitis C, let's talk about hepatitis A. Hepatitis A is something that you hear so much about. That also is an RNA virus, not a DNA virus, but it isn't transmitted typically through needle injury. It's contaminated water, contaminated food, contaminated something that gets from someone else's colon, the stool, the fecal material, into your mouth somehow, typically through food. We don't think it's any saliva that transmits it. It's person to person. Sometimes, especially in the male homosexual population, men having sex with men, it can be transmitted during the course of anal intercourse. Food, if it's not heated thoroughly, if it's contaminated, may lead to infection, as can drink, as can water. Now, there is a very, very, very low possibility that it's going to be transmitted if you have a viremia at the time that somebody draws your blood and then is used for a transfusion, or it somehow has contaminated you. That's possible, but that is extraordinarily rare. Hepatitis A is highly infectious. It's present in the feces, in the fecal material, for about 2 weeks before and about 1 week after you become ill. The likelihood of your dying from hepatitis A is extremely small. And here in the United States, it's not much of an issue, but it's more of an issue if you travel outside the country to areas where the hygiene isn't good, and then you consume contaminated food or water. It's especially a problem if you happen to be around little babies and you're contaminated because you're changing diapers or you're working in a daycare center. So those are issues that we need to be of appropriate concern. We know that the incubation time averages around a month. It could be as little as half a month, a couple weeks, to as many as 2 months. We know that those people who become infected typically develop an acute infection. It's all of a sudden. Now, the interesting thing is, if you happen to be very young, if you happen to be a child, and let's say you're less than age 6, the likelihood of your having symptoms is only about 1 in 10 of those people infected. So 10% of the people infected prior to age 6 are not going to have any kind of symptoms. On the other hand, if you're over age 14, the likelihood of your having symptoms if you get hepatitis A, somewhere around 70 or 80%. What are the symptoms of hepatitis A? They're exactly what I mentioned a moment ago. The symptoms of hepatitis A and the symptoms of hepatitis C are exactly the same. You have the loss of appetite, you have the nausea, the vomiting, the abdominal pain, the joint pain may come with it. Some people develop some fever or fatigue. Maybe you have some itchy skin. Maybe you have the weight loss. You could have the flu-like symptoms, the malaise. You don't feel well. Your skin can turn yellow, your stool can turn light, and your urine can turn dark. That's hepatitis A. How common is it? Well, we said that there were 3,000 reported cases of hepatitis C in the United States. How many cases of hepatitis A, even though we talk about it? Fortunately, we have a vaccine, so it's estimated that the total number of cases reported is only about 1,500, and it's estimated that the total number of cases that actually are present is only about 3,000. So hepatitis A is relatively uncommon. Now, you can have symptoms and they can seem to come and go for a while, but they don't last more than about 6 months. The severity of the disease seems to have something to do with how old you are when you first get it and what other kind of problems you have medically. We know that the virus can live for a while outside the body. Actually, it can live for several days, up to about a month outside the body. We know that if it's in the water, we can kill it with appropriate chlorination. If we have it in the food, we can kill it with appropriate cooking. And if it's on the environmental surfaces, let's say it's in your kitchen, we know that we can kill that with appropriate bleach. Well, the triumph for hepatitis A was a vaccine became available in 1995, and that vaccine seems to have caused a decrease in the number of cases by about 90 or 95%. Now, the vaccine has to be given in 2 doses, and the doses should be given if it's by itself, 2 doses. If it's given with something else, like in combination with the hepatitis B virus vaccine, well, we give 3 or 4 doses. Originally, it was recommended that children should get it at 1 year of age, but now we recommend that basically all people between the ages of 2 and 18 ought to be inoculated, and then anybody at risk. So it's thought that probably we need to go and give a significant number of people the vaccine. Well, what about hepatitis worries if you're going out of the country for hepatitis A? Well, what we know is that if you're going to travel outside the country to an area where the hygiene isn't very good, in the old days it was thought that you should get a dose of immune globulin, but now we think that now just go and get a dose of the hepatitis A vaccine, and that's going to protect you. The immunoglobulin, by the way, only lasts for about 3 months. The hepatitis A vaccine probably lasts in excess of 20 years. Hepatitis B, the old-fashioned serum hepatitis. What do we know about that? Well, we know that it's spread through blood transmission, through parenteral transmission, needle sticks, very common in intravenous drug abusers, but it also can be transmitted during sexual relations, very commonly transmitted through mucosal contact with blood or semen or other kind of contaminated fluid. And we know that it also is transmitted at the time of delivery. So needle sticks are an issue. Intravenous drug abusers very frequently infected with hepatitis B when you share needles or syringes or you accidentally have a needle stick. We said that prior to the time of our being able to test for the antibodies, it was relatively widely transmitted. But now, ever since 1972, we've had the ability to test blood. So as a result, the incidence of hepatitis B has fallen dramatically. It's still an issue with men having sex with men, or people who are present in sexual disease clinics, people who are more promiscuous are more likely to become infected. We know that a household contact, as opposed to hepatitis C, where there isn't spread to household contacts through sex, in hepatitis B, that's not the same story. So sex partners ought to be extremely careful. How common is the disease? Well, again, about 3,000 cases are reported, but because of underreporting and because a lot of people don't develop any kind of symptoms, we know that a significant number of people may well be infected. So it's estimated that even though we only know of about 3,000 people infected, probably the total number is 13,000 to 19,000. And it's estimated that over the course of the globe, if we look throughout all of the different countries, we find that this is an extremely common virus. It's estimated that probably somewhere around 240 million people, maybe as many as 350 million people are going to be infected. So probably about twice the number as with hepatitis C. It's estimated that as many as 750,000 people die every year because of this particular virus. Here in the United States, it's estimated that probably somewhere around 1.25 million people have chronic infection with hepatitis B. It's estimated that people of Asian descent, people Pacific Islanders, seem to have a higher incidence, as do men having sex with men. The Incubation period, well, all these hepatitis viruses are long-term incubation, so it lasts the incubation period anywhere between about a month and a half up to about 5 months. We know the average incubation period is about 2, 3, or 4 months. The acute illness, as with hepatitis A, tends to be relatively mild. It's not fatal. But we do know that somewhere around 1,800 people are going to die of hepatitis B virus every year here in the United States. We know that if you happen to be an adult and you become infected, then you have a good chance of triumphing over the virus, but still 10-20% of the people going to go on and develop chronic disease. However, if you're infected at a very young age, you have a very good chance of going on to develop chronic infection. It seems that hepatitis B and hepatitis C both vie for the title of being the most common cause of hepatocellular carcinoma, so the likelihood of developing cancer of the liver is probably the same in both hepatitis B and hepatitis C. Symptoms, if you get them, going to last for several weeks, maybe a couple months. So hepatitis is not a disease to be thought of very lightly, but we do know that the likelihood of your developing symptoms, as with hepatitis A, is very uncommon if you happen to be very young. So in those people who are less than about a year, well, the likelihood of becoming symptomatic with infection is probably only about 1%. As you grow older, as you grow to age 5 or more, then the likelihood is probably about 50-50. In adults, probably somewhat more likely that you're going to develop some symptoms. But a significant percentage of people who develop infection are not going to have any symptoms. What's the likelihood of developing chronic hepatitis if you're infected? Well, if you happen to be infected in infancy, the virus passed on from mother to child, chances are overwhelming that you're going to develop chronic hepatitis B. That's in excess of 90%. On the other hand, if you're more than 5 years of age, the likelihood of developing chronic hepatitis is only about 5 or 10%. Now, we do know that if we're talking about the hepatitis, well, maybe overall, a third of the people going to develop symptoms, and the symptoms are going to be exactly the same as I mentioned a moment ago. Same kind of symptoms with hepatitis A and hepatitis B and hepatitis C, should they develop. You're going to have loss of appetite and pain in your joints. You're going to have some abdominal issues. You're going to have some vomiting and nausea. You're going to have some fever, and you're going to have the itchy skin. You're going to be tired. You're going to have a flu-like syndrome. You're going to have general feeling of being unwell because you don't eat. You're going to lose some weight. Your skin's going to turn yellow. All of those things. Now, we do have a vaccine available for hepatitis B. And the vaccine is extraordinarily good. It's extraordinarily effective. Who should get the vaccine? Well, probably pretty much everyone, but certainly those people who have hepatitis C, because if you're infected with hepatitis B after you already have hepatitis C, the disease is going to be very active. We know that men having sex with men ought to be immunized. We know that if you have a household contact who has the virus, yes, indeed. We know that intravenous drug abusers and people who have occupational risk, people who are on hemodialysis, and those people who have HIV ought to be vaccinated. People with liver disease, people who travel to countries where you have a lot of hepatitis B, also good idea to get vaccinated. And people who go to jail, we know that there's a lot of this kind of virus, whether we're talking about the hepatitis C or hepatitis B, they're in jails a lot. People who are incarcerated have a significant percentage of infections. So we have to be careful. Are there any treatments available for hepatitis B? Sure. We don't usually treat acute infections because we know they're going to go away spontaneously. But if you have a chronic infection, we do have certain kind of diseases, certain kind of medicines, rather, to treat you with. So that's not typically going to be an issue. We have a vaccine. The vaccine is to be given in 3 doses now and in a month, and then 6 months following that. We can either use the hepatitis B vaccine that has only one antigen, in other words, it's effective only against hepatitis B, or we could use it in combination with the Haemophilus influenza vaccine or the diphtheria, polio, tetanus vaccine, or we could use it with the hepatitis A vaccine. We have a series of blood tests that we can do that give us a good idea about what the status of the infection is. We can tell whether you have acute infection. We can tell whether you've been immunized. We can tell whether you're able to transmit the virus or not. All of those tests are very important, and they're available. Then we have another kind of virus that most people have not heard of. We have the hepatitis D, as in dog, or David, hepatitis D virus. It's an incomplete virus, and in order for it to be passed on, and in order for it to cause any kind of problems, you have to have infection with hepatitis B. So the hepatitis B, as in boy, has to be present in order for you to become infected with hepatitis D. It's an RNA virus, and it can either cause acute hepatitis or chronic hepatitis, and it's passed on through blood, and it's relatively common in those people, men having sex with men, people with intravenous drug abuse. But as I said, you have to have infection at that time with hepatitis B virus. Otherwise, you can't get it. And fortunately, this one is not common in the United States. Well, we have another kind of a hepatitis virus. We have hepatitis E. E as in Edward, hepatitis E virus. This tends to be more prevalent in areas in the developing world. It tends not to be terribly present in the United States, but anybody going on vacation, especially those people who like to go to areas in the Middle East or in Africa or in Asia, who are going to those cities or areas where the hygiene isn't very good, you do have to be careful, because this is a virus that's widespread, and it's widespread in the developing world, and it's thought to be transmitted much like hepatitis A, the oral route, because you have some deer meat or pork or shellfish, or maybe you have some organ meat from a pig or a boar, something like that, or you drink water that's been contaminated maybe in Central America or in Africa or in Asia or the Middle East, or you happen to have been a person who went to help in some of the refugee camps, or some of the people from the refugee camps come over here, overcrowded areas where we have temporary housing, or after natural disasters can occur. As I said, it's fecal oral, just like the acute hepatitis A. And we know that for the overwhelming majority of people, there is not a chronic kind of hepatitis E. Now, hepatitis E is an RNA virus, just like the hepatitis A and hepatitis C, and people get it, as I said, from traveling to areas of the world other than the United States. However, over a period of time, we've now found that there are some people who develop antibodies to hepatitis E who have never left the country, so the virus is here. Now, for the overwhelming majority of people who get hepatitis E, there are no significant problems. You get over it. On the other hand, if you happen to be a pregnant woman and you are infected with hepatitis E, chances are you're going to have a very severe, a fulminant hepatitis, and especially if you develop it in the third trimester, you have about a 1 in 3 chance of dying. This can be a horrible disease. We know that those people who are especially prone to the virus are between the ages of about 15 and 44. It incubates for a couple weeks to a couple months. Tends not to become chronic except in people who are immunosuppressed, because maybe they're getting some medicine for the psoriasis, or maybe they're getting medicine to prevent their arthritis, or maybe they have a liver transplant or a kidney transplant, or maybe they're on cancer chemotherapy. Then the virus can become chronic. Now, interestingly enough, not only do we have hepatitis A and B, of course, hepatitis C that we're talking about, but we have hepatitis D, hepatitis E, and now we have hepatitis F that was originally described in 1991. It doesn't seem to cause a discrete disease. There's no diagnostic test for it. And we now have hepatitis G that's somehow related to hepatitis C. It was described in 1995, and we don't have any kind of specific disease that it causes, but it is there. Now, when we talk about hepatitis in general, remember, hepatitis does not have to come from a virus infection. Viral infection is obviously a very common cause of hepatitis, but you could get a hepatitis picture because you've inflamed your liver from drug abuse, or you're drinking too much alcohol, or you're just simply too fat. We know that there's a condition called non-alcoholic steatohepatitis that's a relatively common condition, especially with our increasing girth in our society. We know that certain diseases can cause it and certain toxins can cause it. Overwhelmingly, if you have acute hepatitis, it's going to last for less than about 6 months. If, on the other hand, you develop chronic hepatitis, it's going to last for more than 6 months. So acute hepatitis is hepatitis of less than 6 months. Less than 6 months. Chronic hepatitis, more than 6 months. And we have to remember that when we talk about the viral inflammations of the liver, hepatitis B and hepatitis C together about 3, 4, 5 times more common than the HIV type of infection. Well, how many people in the United States are infected with chronic hepatitis? Tough answer, tough question. We know that the estimates are somewhere between maybe 3.5 million to 5 million people have chronic hepatitis of one sort or another. We know that in many cases, all of these types of hepatitis can just last for 20, 30 years without causing any kind of problems. Now, as we mentioned before, it's estimated that somewhere around 15,000 people going to die every year, might be as few as 3,000 people. We know if you have chronic hepatitis, no matter what the cause is, and if you drink too much or you have some other kind of problem, some other kind of issue, maybe you're infected with HIV, then you're going to make matters significantly worse. What's the liver do? Well, why is the liver a problem? The liver is a problem because it's a very important organ. We tend not to talk too much about it, but it has a very significant function. It takes all of the blood coming from the intestine and it detoxifies it. It takes any kind of harmful substance and makes it basically non-harmful, and then it shoots it out into the bile. It metabolizes drugs. It metabolizes alcohol. It makes the cholesterol, the bile, and the clotting factors, and it stores all sorts of things, including sugar and fat and vitamins. And acute hepatitis, when we inflame the liver, fortunately, it causes the same kind of symptoms, irrespective of the cause, but it can go on to cause a chronic kind of hepatitis in those cases where we're talking about hepatitis B or hepatitis C. And when we have a chronic hepatitis and it's symptomatic, that's the important thing. Chronic hepatitis does not have to be symptomatic. If it is symptomatic, and if it causes significant damage to your liver, it can go on and cause a problem with your appetite. Your appetite goes down. Liver is important to make protein. Well, how can you make your muscle if you don't have a decent liver? You can't. It is important in the sodium handling. So if your liver doesn't work over a period of time, you're going to get a fluid buildup in your legs, in your belly. You're going to have difficulty urinating. You're going to have, ultimately, a hepatic encephalopathy. Hepatic encephalopathy, where your brain doesn't work. There's going to be an altered mentation. There's going to be altered thinking. And if your liver doesn't work well, because you have fibrosis and scarring, the blood isn't going to be able to get through the liver. If the blood can't get through the liver, it's going to be shunted somewhere else. And when it's shunted to vessels that aren't supposed to handle the high flow, those vessels become what we call varices, like big dilated veins, like varicose veins, and they can rupture easily. And when they rupture, then you can bleed, and you can bleed a significant amount. And the blood can come from your upper gut, in which case you vomit blood, or in your lower gut, in which case you pass a lot of blood per rectum. And also, when you get a sufficient amount of liver damage, you could go on and develop the hepatocellular carcinoma associated with weight loss, inanition, anorexia, and then you go on and you can die. So all in all, we know that there are many forms of hepatitis. Hepatitis C has taken a significant front role, and the front role for hepatitis C now is caused by our ability to treat it. What we have to do, though, is we have to decide, do we need treatment or don't we need treatment? And we'll discuss that, as well as the treatment, next week when we come back. Thank you for watching.